All right, I'm going to be doing medication administration today on the patient whose name is Skylar Hansen. Date of birth is 4/12/2020 or 20XX. And the patient is diagnosed with pneumonia, angina pectoris, hypertension, and iodine. Before entering the medication room, I'm going to practice hand hygiene. The first thing I'm going to do is my first check of if the medication's okay to give. Again, the diagnosis is pneumonia, angina, and hypertension, so I know that atenolol will work there, as well as the furosemide, which are given at the 8 o'clock and 9 o'clock rounds. Before also doing this, I did check the patient's blood pressure and pulse, and that was all within normal ranges, as well as the patient's potassium levels, and that also checked out. So the first check I'm going to do is I'm going to have the patient's name, line up with my medicine. First is going to be atenolol. Skylar Hansen, atenolol, 50 milligrams orally at 8 o'clock, and the expiration date for atenolol is 12/2022, and the next one is going to be furosemide, so Skylar Hansen, lining up with my MAR. Skylar Hansen, furosemide, 40 milligrams orally at 9 o'clock. All right, and then after that, the expiration date is 12/31/2021, again for furosemide. After I finish my first check, I'm going to go down to right outside the patient's room and perform my second check. So again, reiterating what I just said, patient Skylar Hansen, atenolol, 50 milligrams orally at 8, 12/2022, and then Skylar Hansen, furosemide, 40 milligrams orally at 9 o'clock. Expiration date is 12/31/2021. So after that, I'm going to knock on the patient's door. All right, perform hand hygiene. Hello, Ms. Hansen. My name is Max. I'm going to be your nurse today. I'm going to be giving you your medicine for the 8 o'clock and 9 o'clock rounds. Is that okay? She says yes. Ms. Hansen, could you please verify your name and date of birth? And the patient says it. And then I'm going to verify that by scanning it on the armband. After that, I'm going to ask Ms. Hansen if she has any allergies, and she says iodine. And I know that with checking my MAR that, okay, that lines up there. I can see an iodine allergy charted. After that, I'm going to ask Ms. Hansen, Ms. Hansen, are you familiar with the medications I'm going to be giving you today? And she, and then I explained that it's going to be atenolol and furosemide. Atenolol is going to be for your blood pressure, and your furosemide is going to be your water pill. She says that she is familiar with them. And I will tell her that furosemide is a diuretic, so it may make her use the bathroom quite frequently. And she says, okay. All right, before administering that, I'm going to scan the medications, beep, beep, and perform my, I'm going to perform my third check. So Skylar Hansen, atenolol, expires 12/2022, 50 milligrams orally at 8. And then Skylar Hansen, furosemide, 40 milligrams orally at 9 o'clock, and expires 12/31/2021. All right, so then I can scan the medicine and then assist the patient to an upright position and give them. I'm not going to rip mine, but okay. After I scan them, I wait for the patient to swallow them, and then I'm going to ask if give the call light to them, and I'll say I can check on you in about an hour if the patient doesn't have any questions, and then finish my documentation.